The Roundtable is really about addressing hypertension in Uganda and looking at some of the challenges that we face in terms of being able to treat and support people living with hypertension, and also looking at what strategies we can put in place to really strengthen primary health care and the management at that level. One of the things that we'd really like to see as an outcome from this is an increase in the availability of medicines and treatments for people living with hypertension, and also support for the healthcare workers who are offering treatment and guidance to those people. So I think that we're very excited to have so many different partners here with us, the Uganda Heart Institute, members of parliament, policymakers and other stakeholders who can really come together and help deliver on that promise of controlling hypertension across the country. Hypertension is the biggest risk factor for cardiovascular disease around the world. It particularly affects all countries, which I think is an important thing. Often it's the consideration of hypertension and where it's a burden and who it has an impact on is not always clear. But I think we've seen this morning that in Uganda, hypertension is clearly a major issue. And obviously, if we're to address cardiovascular diseases and address the mortality in that, then the first thing we need to look at is how to improve our control of hypertension. I think we all have different parts to play. So the World Heart Federation is a membership organization of cardiology societies and heart foundations. So we're able to share the latest research and knowledge and information and practice with others and with our members to help improve hypertension. I think some of the stakeholders here, for example, parliamentarians and policymakers, can really play a big role in pushing this to the political forefront. In terms of NCDs, in terms of cardiovascular disease, hypertension and addressing it is crucial. So if we're to really get that, we need political support, we need resources, and also the healthcare practitioners and physicians. They have an important role when we look at how is the best way of delivering care, how do we ensure that we're all on board, following the same guidelines, following the same protocols, and really working as one. So I think we have different roles to play, drawing on our expertise and knowledge, but clearly we all have a big role to play.